Thank you so much, everyone. Thank you, Sue, for the invitation, and thank you all for coming. It's an absolute delight to be here today. And there's a lot more discussion with mine. There isn't, and just like what Catherine's just done, it will be more of discussing what personalised care is and kind of getting you to think about how you can apply this to practice as well. Sue's done the introduction, so I'm not going to say any more about myself. Go to the next slide. So the discussion will be split into 3 parts. So we would have the first part, which will talk about foundation of knowledge. So I'll just give you a brief background and context, talk about personalised care in maternity services, and then we'll look at PCSPs themselves, so personalised care and support plans. And then there'll be a little bit of just a look of what we've been doing in my trust in terms of progressing the personalised care ambition, and the final part will be how you can apply what we've discussed today to your practice. But before we do anything, I would like to, if this works, right, let's try and solve a riddle. Okay, and some of you may have probably heard of this riddle before. If you have, brilliant, do share with us what you think. And if you haven't, or if you've attended one of my personalised care teachings, you've probably seen this before. This is not mine, by the way. This is a riddle that's available for all of us, but it really does jog our memory and kind of bring us back to the basics and thinking outside of the task-oriented practice that sometimes we find ourselves in. So I'll just give you a few seconds. I've only got 20 minutes, so I'll try and not go over my time soon. So just a few minutes to read through this riddle, and then we'll solve it. Actually, a few seconds rather than minutes. Are we all good? Yeah. Wonderful. Now let's go back. I got my slides mixed up, by the way. Okay, so how can this be? Can I just have a show of hands of those of you that think the answer is the father did not really die at the scene, it's an illusion? Show of hands? No, no. Who thinks it's B? The boy has 2 fathers. No, and it's possible, isn't it? Or C, the man who died at the scene is not his real dad. Yeah? 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 Okay, that's great. I always say there is no wrong answer. But for this particular riddle, there is an ideal answer. Okay? So the surgeon is the boy's mother. It could be because of the way the riddle was written, to play with your mind, because it has a lot of mentioning of father and son. So you start thinking about a man, male, surgeon, and going back to what we've been conditioned to think, that professionals or medical professionals are mostly male. So what can we actually learn from this riddle? Unconscious bias is real and widespread. Even when we consciously believe in equality, our ingrained social conditioning can lead to automatic assumptions. Yes, it is the society we grow up in. It's not really to do with who we are. It's just how we've been brought up. So biases aren't just about gender. They extend to race, disability, sexual orientation, age, and more. So therefore, recognizing and actively addressing these biases can help us deliver safer, more equitable, and more personalized care. And we hear this all the time, don't we? We do have a safety ambition in maternity services. And if we practice always thinking about the woman who's walking through the door that does not want to be examined vaginally, and us not calling her difficult, and maybe looking a bit more into her history, and having that time to have that meaningful conversation. We have the conversation, but it needs to be meaningful. Right, so now let's get to some of the bits within my presentation. Okay. So what is personalised care? Personalised care, I always say, think about choice and control. Choice and control. Personalised care, it's about us putting the woman or the birthing person at the centre of their care. And once you think about it that way, it really is something that you're probably already delivering anyways. However, it needs to be intentional. And that is where sometimes we forget that don't think about it as, oh, I've been asked to do this and I've been asked to do that. Always think about, I want to make this a better experience for this person that I'm caring for. Choice and control. It's not exclusive to maternity services, okay? So this is a whole NHS ambition, and there is a personalised care NHS model. And there are 6 components. So enabling choice, including legal rights to choice, shared decision-making, personalised care and support planning, social prescribing and community-based support, supported self-management, personal health budgets. If you would like to read more about personalised care and the intrinsics of personalised care, please go ahead and have a look, because all these components are very, very much associated with personalised care. In maternity services, we tend to focus a little bit more, or maybe we are more familiar with personalised care and support planning, sometimes social prescribing and community-based support, but there is a bit more to it than that. Okay, so I'm not going to really go through this slide because we've kind of highlighted that already. But how did it all come about? So if we think back at Morecambe Bay, we think back about, all these safety reports and all these policy documents that have come about, we cannot forget better births when we discuss personalised care, because this is all part of the ambition for us to provide safer, more equitable and more personalised care. And one of the things that I really like to highlight is that let's not forget that PCSPs, which is personalised care and support plans, is for all women and birthing people, and not just for women who wish to birth outside of the usual recommendation or outside of guidance. Because sometimes when you think about, you mention personalised care and support plans on labour ward, and everybody's like, oh, you can just feel it. But that's not what it's about. Every woman, every birthing people is entitled to have a personalised care and support plan along their pregnancy journey. Why is personalised care important in the current landscape in maternity services? We hear it all the time. Women want to be heard. They want to be listened to. We have lots and lots of data to prove this, that women find that the care that we provide sometimes doesn't meet their expectations. And healthcare professionals, midwives, I know because I'm one myself, and I work with a lot of midwives. We really do try our best, but there is so much more that we can do better to turn these policy documents and to turn these safety reports around for the better. I would like to now share some of the things that we've been doing in my local trust. My role, like Sue mentioned, I juggle quite a lot, but it all does come together in the end. And one of the best parts of my role is that I get to work with birthing people. The MNVP is very much involved in the work that I do, particularly my PhD as well. And when I did my scoping review, I felt that it was really worth exploring locally what choice means to our population, because when you talk about personalised care, remember I said choice and control. So it's choice and personalisation. What does this mean to our local population? And I got feedback and turned it into an animation to show you all today. How do I play this? Sorry, it's a video. Oh, there we go. Sorry, I should have said. Yeah, it's better with the sound, but it's okay. We can't. Thank you. sorry. You can see the words that come out, and this is what our population wants. So education and resources, making all my decisions easier to make. Choice. So I'm just going to start again. Thank you.
Choice to me means my feelings matter.
Choice to me means empowerment over my own body at a time when it had been taken over as a baby vessel.
Choice to me means knowing all my options and having a voice.
Choice to me means the entitlement to education and resources, making all my decisions easier to make.
Choice to me means giving me all the information I need to choose right and then letting me choose.
Choice to me means openly discussing and understanding all the options that are presented to me without being coerced into doing anything.
Choice to me means making an informed decision, having been given all the information in an unbiased way.
Thank you. So you can see here that a lot of the words that are coming out very, very similar to what is in our policy documents and what we should be offering and meeting the needs of our population. So this is what came out of that exercise. One of the other things we've done, and this is something that you can take back as well, is co-designing and co-producing the document itself, the personalised care and support plan, and we've done this within our LMNS with the MNVP. So this is actually something that was led by our MNVP, and I thought I'll share that with you as well. The other thing that we've done is hold a maternity choice and personalisation event, and something that I actually led and put together, and it was virtual. So sometimes you just have to use the resources that you have. It can be very difficult to put a group of midwives and obstetricians and other birth workers, including our service users, our women and birthing people, and their partners and families. Sometimes it's really difficult to get everybody in one place. So do think about using technology. So this was online. We had 2 events, very well attended. Our professionals were able to share some of the work they're doing to progress the ambition, and we had feedback as well from our women and birthing people of the care that they've received. So it was really nice to have that two together and have those conversations. Feedback from the event. So what did you enjoy most? These are from professionals, so really enjoy the presentations, great mix of topics. Personalised care for women after loss was covered as well, which some people felt it was really helpful. And somebody said, really enjoyed the session, love to hear patient feedback in real time. So it did just that, and this is what, it's really important to understand what your population wants and how the birth experience has been like. And how can we make the event better? So need the event to be longer to allow room for more discussions and questions. Somebody said, nothing I can say, loved it. It was great, good time of the day too. Can it be face-to-face? So which is something that I was thinking about as well. And working together with our LMNS on this, and more patient experience. So you can see that, yes, we do as professionals want to hear these feedbacks because it does help us with the way we offer and deliver care. How can we better support for women who do make choices outside of guidance? Somebody said that would be useful as well. If you did want to read about the work that we have done, I have written an article and it has been published by the lovely Maternity Midwifery Forum. So you can just type in my previous surname, so Patience Pounds there, and it will just come up. It's very simple to read article, just showcasing what we've done really. And it's really important that you do the same. If you've done any work in your local areas, do share it, because it's all about sharing good practice. We need to know what's happening to progress the ambition. Sorry, having fun with this today. There we go. So how can we make women feel more listened to? Example conversations. So if we think back about our policy documents and our safety reports of what women are saying, they want to be heard, they want to be listened to. What can we do? So we're always thinking about how we can make women feel more listened to. So what matters to you has been proven to open conversations rather than saying, is there anything else I can do, or do you have any questions? What matters to you does open a different kind of conversation, makes you stop and think, doesn't it? If somebody says to you, what matters to you, be like, oh, actually, yeah, what does matter to me, you know? And it doesn't only have to be about the pregnancy, it could be anything to do with who they are, it could be something to do with their housing, it could be anything really. That's what personalised care and support plans does. It doesn't just look at the clinical needs, it also looks at the social needs as well. And what do you already know about? So these are kind of prompts to get conversations going. So what do you already know about X, depending on what you're discussing? Can I tell you about X and provide information for that? And then what are you thinking now? These are all, just techniques of how we can get good conversations going. It's called motivational interviewing techniques as well. If anyone's had that training, that also helps. The BRAIN acronym, so you've probably all seen this before. So using the framework such as BRAIN can help women and birthing people navigate pregnancy and birth choices and feel proactive in their care. So the acronym helps women to have meaningful conversations to support their decision making. The tool can empower women to ask professionals for further information about supporting evidence and alternative options. Many trusts have designed their own resources based on the BRAIN principles, and the framework is supported by the charities such as Tommy's and Birthrights. And then there is an S there for second opinion. So this is something that, we do need to make women aware that they can always ask for second opinion. It's about offering everything that is available to our birthing people. And this is one of the last slides, so just a little bit to take away. So personalised care means people have choice and control over the way their care is planned and delivered. It is based on what matters to them and their individual strengths and needs. For informed consent to be given, the person must be given all the information about what the treatment involves, including the benefits and risks, whether there are reasonable alternative treatments, and and what will happen if treatment does not go ahead. So this is thinking about the general provision of generalized care really. And as clinicians, it is not up to us to allow. We're very, sometimes we get caught up using these words. We have to be very careful on the words that we choose. So, or approve birth preferences. Our role is to provide the information necessary for an evidence-informed decision to be made. So using a framework such as BRAIN or BRAINS can help women navigate pregnancy and birth choices and feel proactive in their care. So just reflective questions for you. You can take a screenshot of this, something for you to take away and just reflect on based on today's presentation. So why is PCSP important in maternity services? What are the advantages and possible challenges for women and birthing people? And what are the advantages and possible challenges for staff? One of the things that have come out when I have done personalised care teachings is time constraints, that staff sometimes feel that they just don't get the time to go through personalised care and support plans with women and birthing people, which is an issue I can imagine everywhere else. So just kind of looking at the challenges and the barriers, and as an individual professional, what it is that you can probably do to try and tackle some of these challenges? Ooh, not quite. Oh, we're done. I'm just gonna conclude on here. So just to conclude, personalised care and support planning can help build confidence by preparing women and birthing people through shared decision-making, informed choice, peer support and education, which can lead to safe, more equitable and more personalised maternity care. Thank you so much. You've been great.